Hey everyone, Sean Peers from Dental Peers, and welcome to Quick Hits, brought to you, of course, by Dental Peers. I am the president and CEO of Dental Peers, and I have a really exciting, going into some cutting edge stuff today, topic to present to you. And I am joined by a practicing dentist out of Beverly Hills, California. So, he's probably, if he's not practicing dentistry, if he's not out there learning and lecturing on all the things about artificial intelligence that's coming into the world of dentistry, because he's an international speaker, he's not doing those things. He's probably out surfing or something like that and having a good time in that California weather. Dr. Kyle Stanley. Dr. Stanley, thanks very much for joining us.
Yeah, thanks for having me. It's my pleasure to be here.
Yeah, welcome to virtual Canada.
I love it. I grew up playing ice hockey, so I'm very comfortable being in Canada.
Oh, excellent. Well, we always love people that appreciate the good old game of hockey. Always welcome to chat about that at any point in time. But today, I'm going to bring the focus a little bit away from hockey, and I want to talk to you a little bit about where technology is going in the world of dentistry, and specifically the topic of artificial intelligence, or, if we like to be lazy and just call it AI, because that's sort of easier to get it out. So where do you see AI going in the world of dentistry at this point in time? And is it there yet? Is it here?
Yeah, well, AI is definitely here, I think, in all aspects of as consumers, right? It's in our phones, it's in our cars. It's in our, Alexa or Siri, or sometimes even in our microwaves and our refrigerators. So why haven't we brought it into our dental practice where we can really help our patients? And it's definitely here. Now, it may be in its infantile stage, but it's definitely here and being used by, thousands of practices around the world already. And one of the big things with AI, I think, is that it allows us to get all of the value out of all of the painstaking things we've done with digital dentistry over the last 20 years. So I can bring up a slide on this too. Over the last 20 years, digital dentistry has been this big thing, right? We have digitized every aspect of our practices. We've digitized our charting and our radiographs and our intraoral scans. We have all of this data that we're sitting on, but none of the data is really talking to each other. And even if it's not talking to each other, there's so much data that it's something that us humans can't understand. So like if I gave you 1,000 charts and said, hey, check out these 1,000 charts and tell me all the trends that are happening in these charts. Our brains just can't handle that. But the AI can take those charts, analyze it, and then find the trends and find opportunities within our practices.
So that's a big why as to why dentists should be thinking about, what could AI do for their practices?
That's right. Yeah, we found that so many dentists are looking for more patients. But many times we're sitting on so much opportunity in our practices that we've missed, or that's unscheduled, or, just is sitting there, but we're not taking advantage of it. And the AI can be that second set of eyes that goes through all of our radiographs, all of our charts, all of our intraoral scans, finds these patients. Hey, look, I found this carie and it's not noted in your practice management system. And this is something you want to look at. And just give the doctors a second set of eyes to look at all their radiographs and make sure that they're treating their patients better.
And that's the big thing, right? Like you said, there's just so much data out there. No matter how good we are, and there's excellent clinicians out there, it's always nice to have that reassurance that that there's a machine out there that can help us with little things that maybe we might miss that before they become big things.
Yeah, and then it also brings up this idea of inconsistency. As humans, we're good at a lot of things, right? We have general intelligence is what it's called in relation to a computer that has more narrow intelligence. So, I can fry an egg, I can read a book, I can make a cup of coffee, and I can read a radiograph. Now, the computer can't do that. It can usually do one thing, the AI, read a radiograph, or maybe it could look at something else, but it can't do everything at once. What us humans are bad at is being consistent. So if you show me a radiograph today and then you show it to me in 6 months, I may give 2 different diagnoses. I may see different things. If I'm tired, if I'm stressed out, I'm not consistent. And we know that the computer is. So some examples of that you see in this slide is the study we did on the right side. We took three dentists and asked them to analyze almost 9,000 images. And what we find, excuse me, is that one dentist sees caries 5% of the time, another dentist sees caries 8% of the time, another dentist sees caries 16% of the time. And that is difficult for consumers to understand, that we are just inconsistent. So especially if you're analyzing a big office, right, like a DSO, and you're managing 100 different doctors, you want to try to have some type of a standard. And AI can be that standard. Like on the left side of this slide, where you see, if you look at the bottom, treatment costs. On the left side, you'll see $300,000 to $36,000. We asked 136 doctors to look at an FMX and treatment plan this case. And you get treatment plans from $300 to $36,000. Now imagine being the patient. Who's right? Do I go with the person who's more conservative, who maybe wants to do more treatment? Who do I go with? And AI can be that second set of eyes for the patients, for the doctors, and try to have some type of standard.
And we like that. We like the idea of a standard. And who knows, maybe that's, maybe I'm answering my own question a little bit, taking your words to answer my next question a little bit, but is it that standard or something else? Where would you see the biggest impact that AI can have on the dental industry?
Yeah, I mean, definitely in the clinical realm, as far as taking what we have currently and adding an extra layer of intelligence on top of it. So right now, I work with 2 great partners, and I have the luxury that I can bring a radiograph back and say, hey, Matt, take a look at this. What do you see here? Do you see this? And I have that second set of eyes, right? But many doctors don't. And even if you do have another doctor, they may be with another patient. So this brings that consistency. I think probably the biggest impact is going to be trust, because we have a trust problem in dentistry, right? We're one of the least trustworthy professions when they take surveys of professions. And that's hard for me to understand, because every dentist I know is trying their hardest and, doing their best, trying to support their families. So if we can bring trust that says, hey, Mrs. Jones, I don't just think you have a cavity here, but 1,000 dental brains from around the world would agree with me, and this third-party AI system says that you do too, I think it's time that we should look into doing this treatment. That brings trust, especially in new patients. So that's probably the biggest impact. And that trust allows patients to get better treatment.
Now, is the AI, because I know we're talking sometimes in terms of cosmetic procedures as well, is the AI going to be helping with some things that, maybe we're not talking in terms of, okay, we've got someone with a root canal, we have a serious oral health concern. Here we're talking more purely cosmetic features. Somebody doesn't like the coloration of their teeth. Maybe they're looking at doing something about that. Is the AI going to be able to play a role on that front?
Yeah, for sure. That's already being used in certain applications. There's an app called Smilefy, and what that does is utilizes artificial intelligence to decide on shapes that best fit the face. So, there's many different shapes of teeth, right? You can have triangular, you can have square, you can have oval kind of shapes, and they may all work. But what the AI does is takes the shape of the face and different aspects of it, and then organizes that so that, especially maybe for new doctors or doctors that aren't as aesthetically minded, it can give them a recommendation. They can always make the changes, which is similar to, the radiograph as well. The doctor is always the final say. The AI is here to organize our thoughts. It's here to give us recommendations, and the doctor can go in and say yes or no. So yeah, it is being used in Smile Design, and also it's being used on the 3-dimensional CAD software. when, you take a scan, the AI can give you a recommended shape that then the technician can go in and make changes if they want to. But it's allowing it to be more natural and, take out some of the mundane tasks that we have to do repeatedly.
Right.
Make it more consistent.
Your comments are always just kind of like one step ahead from where my next question is going, because when you talk in terms of the link with the CAD dentistry, and I'm thinking, okay, so we've got AI, we've got digital dentistry, which, as you said, has been around for a while now.
Yeah.
How are we juxtaposing them? How are we working a crossover so that we can really more effectively use AI to make our digital component more efficient and the end product that much better?
Yeah, well, there's a few aspects, a few ways of doing that. Let me bring up another slide. One way is kind of like what we're doing with robotic surgery, where you're taking what we've already digitized, which is the CT scan, the intraoral scans, bringing those together, and then the AI figuring out where the ideal placement is for the implant and placing it digitally so that the doctor can review it. Now you take that and bring in the robot, and the robot can place the implant in the absolute ideal position. In addition, you have things like real-time adjudication with different insurance programs, to where we've digitized the charting, right? We've digitized the radiographs already, but where AI is going to come in is automate the adjudication process for insurance programs or government programs, so that we don't have to wait weeks to get approvals. They can be done when the patient is sitting in the chair. And that is just really nice for consumers, I think, for patients to sit down, know what they have to pay, don't have to pay, what the doctor is going to be paid, and allow the patients to get the better treatment.
Yeah, I mean, and it's that immediacy, right? It's, kind of like what the immediacy that CERAC brought into the world.
That's exactly
a few years back. Now we're going to step it up a little bit more.
Mm-hmm. Yeah, you can do things too, where you can take our digitized practice management systems that, like I said, we've spent 20 years perfecting, but then add a layer of intelligence on top of them. So like in this video, what you see is it's going through the schedule and finding patients that have opportunities on your schedule today that hasn't been detected. So, whether the doctor missed it or he or she was busy that day or whatever it may be, now we can say, hey, this person's coming in. There are these little, carious lesions. Let's have the doctor take a look and see if he or she wants to treatment plan them. And maybe we can do them today. Maybe we can do more same-day dentistry and prevent these from turning into larger carious lesions.
And I think that's the big thing. I mean, I can imagine a lot of dentists that are sitting there looking at that picture that you had brought up of that robotic arm and combining that with artificial intelligence to be able to do some of the diagnostic work and thinking, well, who needs me anymore?
Right. Yeah. Well, it's not us versus the AI. It's us plus the AI. It's the doctor plus the AI. And I always give the example, because I love cars, of intelligent cruise control. You think of Tesla or this and that. What we're not saying is let the cruise control take over and you go to sleep, right? You still are there with your hand on the steering wheel, the accelerator, the brake pedal. You're still in control of the car. It's just like this. You're still in control of your patient and of the radiographs, but you have this extra layer of intelligence that's going to allow you to be more consistent, not make mistakes, decrease your liability, and, hopefully enjoy the practice a little more and maybe even make more money.
Well, I know I read a book about a year or so ago, and it was talking about this study. I think it might have been done out of MIT, and it was dealing with diagnosing breast cancer situations. And it was taking experts in the field to look at some various radiographs, and then also running it through AI to compare the results. And then it ran through so that both. And what actually wound up happening is the best case result was a combination of the expert diagnosis and the AI. Like the two together were better than the doctors alone, better than the AI alone. And I think people need to be able to look at that and say, this is my partner. This is going to make me a better dentist.
That's exactly right. It's the intelligence of the AI plus the intelligence of the doctor, and together you get the best outcome. This is not here to take over your job. This is here to make your job more enjoyable, to make you more consistent, to offload some of the tasks that you don't want to do, right? Any potential tasks that you don't want to do, maybe we can offload that, but it'll make us better doctors. And, I'm really for making us better and for reducing our liability, and if doctors can make more money too and treat their patients better, that's really a win-win.
And there's just so much exciting stuff that to still come from this. And I know Pearl might be a name that's going to be new to a lot of people, particularly up here in Canada. But you guys are developing a lot of great technologies. I've followed along. I've seen the news with different patents that you guys are obtaining for certain tools. So talk to me a little bit about Pearl in general and where you guys are going as a company in the AI dental world.
Yeah, so Pearl was spun out of a previous company that our CEO and the CEO had founded back in 2008. And that was a company that was focused on artificial intelligence, but for the advertising space. He grew that to be, a multi-billion-dollar company. And we incubated Pearl within that company, Gum Gum. And he basically wanted to apply what he was doing, what they were doing at Gum Gum in advertising, but do it to dentistry. So we did that. We ended up spinning it out in 2019. And we're really just focused on solving difficult visual problems in dentistry, whether that's radiographs, whether that's intraoral scans, chart notes, CT scans, on and on and on. There's just a lot of opportunity where we can add in an extra layer of intelligence. I think when you're looking to the future and where we're going with Pearl is, we really think that even in a few years, it's going to seem silly that we would look at radiographs without some type of intelligence on top of it. I think this will really be like electricity in dentistry, like we're not using belt-driven handpieces anymore. I think that's how this is going to be looked at. It's just going to be an everyday part of our life that is making our lives better.
Well, it certainly is exciting technology from my standpoint. And if anyone wanted to learn more about Pearl, who would they reach out to? What's the best way to get in contact with someone that if they had inquiries to learn more about what Pearl might be able to do for their practices? What's the best?
Yeah, you could just go to our website, hellopearl.com. And there's contact on there, and that goes to a few of our team members. So that's the best way. Or you can contact me on Instagram. It's just Dr. Kyle Stanley, Dr. Kyle Stanley. And you can message me on there.
Great. Well, Dr. Stanley, I really appreciate this exciting information that you're sharing with us today. I think it's really, it's a dynamic step going forward, I think, for dentistry. And I'm pretty excited to see where it can go. Any final thoughts before we wrap up in terms of where you think things are going for Pearl and for AI?
I would just encourage doctors to be open to this kind of technology and not to look at it as a threat. This is not here to take over your job. This is here to make things better for you. I'm a dentist. Our CEO's dad is a dentist. A lot of our team members, mothers and fathers and grandfathers and uncles are dentists. We are here for the dentist. So yeah, we're here on your guys' side to help you.
So I guess we just won't be seeing, the rise of the machine sequel based on dental AI is what you're telling me.
No time soon.
No time soon. Okay, so Arnold Schwarzenegger will not be back in any facility for the dental world, but artificial intelligence is definitely. I mean, I read about it all the time. I think it's an exciting avenue that we're going towards. It can be really exciting from a clinical and a business standpoint. And just the thought of as Dr. Stanley said, teaming up and having that reassurance to build that bond of trust with patients. These are all great things. So Dr. Stanley, I really appreciate you taking the time to join us from sunny Beverly Hills today.
Thank you. Thanks for having me. It's my pleasure.
All right. So if you have any questions with respect to what Pearl has to offer, as you said, reach out to hellopearl.com. Go to their website. You can find some great information about the company there, and someone can reach out to, or of course, follow Dr. Kyle Stanley on Instagram. And those will be great ways that you can learn more and see where the world of artificial intelligence and dentistry will continue to grow and intersect. So thanks very much for joining us here today on Quick Hits. I look forward to coming back to you with another guest real soon. Take care, everybody.